Hi guys, welcome back to my channel Obgyn Made Easy. In this video I'm going to discuss a missed miscarriage. So what is a missed miscarriage? A missed miscarriage is a non-viable fetus or embryo that has been retained within the uterus without spontaneous abortion. So what happens if a non-viable fetus or an embryo has been retained? If the pregnancy is less than 12 weeks gestation age, there is clotting of blood and surrounding tissue together with the ovum. This is known as a blood moor. The dead ovum and surrounding tissue is either completely absorbed or retained. The retained structure, once evacuated, can be seen as a fleshy moor. However, if the pregnancy was more than 12 weeks gestational age, we expect a fetus to have developed. So the retained fetus becomes macerated, and the pathogenesis is the same as we had discussed in intrauterine fetal demise. So what are the clinical features of a missed miscarriage? How do you make a diagnosis of a missed miscarriage? From the history, there will be no symptoms of abortion like the vaginal bleeding or passage of clots or tissue or abdominal pain. There might be a history of an episode of slight vaginal bleeding which had stopped, and the patient will also complain of loss of pregnancy symptoms like breast changes. There was once breast tenderness which has stopped. Patient complains of abdomen not growing as it should or has become smaller in size. So if the pregnancy was more than 12 weeks gestational age, let's say 16 weeks gestational age, the patient would have noticed that the abdomen is reducing in size and it's not growing as it should. And she also complain of not perceiving fetal movement. As you can see in the diagram here, you have a non-viable fetus inside the uterus that starts to degenerate, and you also have a closed cervix. So these are some of the features of a missed miscarriage. When you examine the patient, you find that the uterine size, that's the height of fundus, is less than the estimated gestation age. When you do a vaginal examination, there might be dirty or brownish vaginal discharge. This is coming from the fluid from the degenerating fetus. The cervix is closed and firm. An ultrasound confirms no fetal movement and no heartbeat, or an empty gestational sac without an embryo. However, if the gestational age is less than 8 weeks, you should repeat the ultrasound after 2 weeks before you make a diagnosis of a missed miscarriage. Because before less than 8 weeks gestational age, there's no much development, so you might make a mistake of making a diagnosis of a missed miscarriage. Complications of a missed miscarriage. The patient might be upset psychologically, she might be in denial, angry, or even guilt ridden. If there's prolonged retention of the non-viable fetus or embryo, you can have blood coagulation disorders like disseminated intravascular coagulation. And during expulsion, you might have profuse bleeding due to disseminated intravascular coagulation. You could also have a retained placenta. Remember, we said there's maceration taking place. And you could also have infection. Management of a missed miscarriage. You do a bedside clotting time. Remember, we said there could be disseminated intravascular coagulation. And you should also do a group and save because there's risk of profuse bleeding and disseminated intravascular coagulation. So if the pregnancy is less than 12 weeks gestational age, you can either have a medical management with misoprostol only or a surgical management with misoprostol to dilate the cervix. Then you do a manual vacuum aspiration. If the pregnancy is more than 12 weeks gestation age, 13 to 26 weeks gestation age, you can either have a medical management where you use misoprostol. Remember that the dosage differs according to the gestational age. Then oxytocin can be used to accelerate the process once the cervix is adequately dilated and effaced. Then you can also have a surgical management. It is only done when misoprostol has been used to soften the cervix. Then dilatation and evacuation is performed. The most preferable method is a medical management first, then a manual vacuum aspiration when there is retained products of conception. After evacuation has occurred, you can send the specimen for histopathology and karyotype. Remember to offer post-abortal care services, which include prevention of infection by giving the patient antibiotics, bereavement counseling, as well as contraceptive counseling. The third, evaluation of sexually transmitted infections, including HIV. So we're going to end here. I'm going to split the video into two. In the next video, I'll discuss on blighted ovum. Thank you.